I've heard you. I think many of the elected officials on this call have heard you. I see several of them, and I don't want to make any mistakes, but if I do, I'm going to correct them as we go along. I see Councilman Tanel Atkins on the call. I see Betty Goodwin Davis from the great city of Lancaster. I see Councilwoman Carolyn Arnold on the call. I see Kyra Mendelson, city council person here in Dallas on the call. I see Barry Gordon, the mayor from Duncanville on the call, and I'm pretty certain there's others. There's at least 100 participants at this point in time, and it's growing more and more. So please put your questions concerning COVID in the chat box so we can spend most of the time answering questions. I see Joyce Foreman. Trustee Joyce Foreman has just joined also. Thank you very much for being here. And we're going to open up the mute button in a few minutes, but what I want to first do is to introduce the Commissioner of Health. I could go through the numbers for you. You know what the numbers are in the world. You know what the numbers are in the country. You know what the numbers are in the state of Texas. You also know what the numbers are here in Dallas County, Tarrant County, in North Central Texas. I think that what you want to do is to hear from Dr. Hellerstedt in terms of where we are, what his role is, and then we're going to open it up and begin answering questions that you have. Dr. Hellerstedt, thank you very much for joining me this evening and joining my constituents. You are the Commissioner of Health in the state of Texas. Can you just kind of give us a global overview and then bring it down to the local level being counties, and more specifically, let's start talking about Dallas County hubs and getting vaccines to people in the community. I just saw over the news that the President Biden has authorized about 200 million more doses of vaccines, and that's just kind of breaking news right now. So Dr. Hellerstedt.
Thank you, Senator West. I really appreciate it. I appreciate the opportunity to speak with you and your constituents. So it's a great privilege to be able to do that. I am the commissioner for the Texas Department of State Health Services. And as you may know, in Texas, we're a home rule state. So in any area that has a city or county that has its own health department, those city and county health departments answer to their mayors and county judges respectively. So we work in very close coordination with our city and county health department partners, but we're not the boss of them. So we have to collaborate in order to get things done. And we do on a regular basis. I mean, that is the way we have conducted public health in the state of Texas for many, many decades. And the COVID-19 pandemic is really no exception. It's really just, if you will, an intensification, really many times more than I think anybody ever has experienced before. It's an intensification of the way in which we have provided public health services in the state of Texas for many decades. So as you know, COVID-19, the pandemic, is now well into a year-long kind of crisis. It has taken the lives of about 33,000 Texans. It's taken the lives of about 400,000 Americans and 1 million people globally. And that's probably an undercount, considering that not all countries are going to be able to count their fatalities with accuracy. But it's an unprecedented crisis. And I think that's one of the things to keep in mind, is that even though public health and scientists, people who study viruses, have been warning for decades that there was the possibility that we would have a pandemic like this, we were not equipped, if you will, from the get-go. And I say that we, I mean the entire public health infrastructure in the United States, in Texas, at the local level as well, simply had never been through a crisis like this. And so we've had to grow and adapt and problem solve on the fly. I know many of you are following what we're doing in terms of public health very carefully, but I can tell you that for everything that you kind of see in terms of problems that we have to encounter and solve. There's 100 others behind the scene that we have had to face every day. And I'm extremely proud of my team and the Texas Department of State Health Services in meeting many of these challenges, particularly with things like, I know we'll get later talking about MTRAC, which is the state vaccine registry. And we really had to upgrade that to meet this challenge. So how big of a challenge is it? I mean, as an example, we have had what we call reportable diseases in Texas forever. It's a standard thing in public health. So we want to know about all the cases of sexually transmitted diseases. We want to know about all the cases of hepatitis B or hepatitis C and various types of meningitis. Many types of communicable diseases are reportable. However, up until COVID-19, we really only wanted to get the positive tests. In other words, we wanted to know who had it. So if somebody went to their doctor and got tested for hepatitis C and it was negative, that we had no interest in that data, so we didn't gather it. But here in COVID-19, it was a completely different story. We needed to know both the numerator and the denominator. In other words, we needed to know both the number of positive tests we had and the overall tests that we had, so how many negative tests we had. And that could tell us, that percentage of positive tests could tell us about the prevalence in the community. So that's just one example of how vastly different it is this time around. In addition, we are in the 21st century, and just like the last really huge pandemic that hit the United States and hit the world was about 102, now almost 103 years ago, the influenza pandemic that was coincided with the end of World War I, and that killed lots of people. But the ironic thing to me is that here we are this much later in history, but we are faced with the same fundamental facts at the beginning of the COVID pandemic that they were back 102 years ago. In other words, we had no vaccine and we had no really effective antiviral medicines. So those two fundamental facts were the same, but absolutely everything else about society had changed. So in particular, our expectations of healthcare, of what would happen to us if we got sick and needed to go to the hospital. When you think about it, if you had influenza back in 1918, it didn't matter very much if you went to the hospital or stayed home. If you could have somebody that could give you fluids and give you nutrition and keep you clean and attend to your needs, that was about all they could do in a hospital setting as well. They had no IVs, they had no medications, they had no supplemental oxygen, they had no ventilators, or any of the kind of advanced support that we expect in this setting. So our primary goal, our strategic goal all along from the beginning of COVID-19 crisis, and I gave the governor the first briefing on this in January of 2020, knowing kind of what might be heading this way. And so the thing that we wanted to preserve the most was the ability to take care of people in an inpatient in a hospital setting. Because don't forget, just because of COVID-19, that doesn't mean that women don't still need to go to the hospital to deliver babies, and people have appendicitis, and there's car accidents and strokes and the like. And we wanted to preserve that ability at all costs, because we knew that if we didn't have that, if people didn't have a sense of confidence that if they got sick, that there was means to help them, a modern level of care to help them, then that would be an extremely serious situation. We would have gone from having a disaster, in my opinion, to having a catastrophe. So we have managed to get by to where we are without having that catastrophe. We have had, though, for instance, even now, we at the state are supplying about 14,000 extra people to work in hospitals in order to preserve that setting. And that's unprecedented. Back last summer when we had our previous peak, we were dealing with about, let's see, 10,800, I think, was the highest level on a given day in the hospital. Now we're just under 14,000 and staying there. And the need to provide these extra folks is what keeps the hospitals going. We can sustain that for a little while, but it's not sustainable forever. And that's why I believe our prayers are answered with the advent of the vaccine. But don't forget, in the meantime, what got us to where we are, which I think is successful, are those other measures. We in public health, we call them non-pharmaceutical interventions. So those are the things like the physical or social distancing, the wearing masks, the washing hands, and disinfecting surfaces. Why do they work? Well, even though this is what was called a novel virus, which means it had never circulated in human populations before, and that meant that nobody anywhere in the world was immune to this virus. And you can see how rapidly it spread. It's extremely communicable. And we now know that people with no symptoms are often the ones who are still spreading the virus. So completely innocently, they're spreading the virus, and they don't even know it. But it's a respiratory virus. So when you're infected, you transmit it by the way you speak, cough, sneeze, breathe. And if you can stay out of range of those droplets that come from an infected person's respiratory tract, then you're not going to get sick. And that's why then adding to that the cloth face coverings or face masks, and you really need to cover your nose and your mouth as well. What does that do? It cuts down on the effective range of that germ, and fewer people get sick. And I know that there were some folks who doubted whether or not that was effective or necessary, but it absolutely is effective and necessary. And our own experience in Texas has shown us that that was the case. So we went from a real peak in the summer, and then really that was when the governor asked for more masks to be worn across the state, and left that with local leadership to lead that. People responded, more people wore masks, and guess what? The amount of infection went down. We suspected that as we would come into the fall season, it's a season where we celebrate lots of traditional gatherings, where we will all want to get close to one another and celebrate Thanksgiving and the Yuletide and all sorts of other holidays, New Year's. And we knew that had the risk of bringing people together and increasing the amount of infection that we saw. And sure enough, that happened. The other thing that happened, I think, is that we, again, now are seeing that the place where people are encountering it isn't just in, say, bars or going to restaurants. It's pretty much everywhere in any kind of gathering where people are not taking precautions and not wearing masks. And I think we've all seen pictures of concerts and other venues, especially where young people are, where they're really just not taking those precautions. And we see that in the data that we have. We see that early on, people who were in nursing homes were especially vulnerable, and the infection was being brought into there. It would spread and would cause great devastation. And so earlier in the pandemic, the most number of infected people was actually in the older age groups. Now, the most number of people with infections is going into the younger age groups, but most of them are far less likely to have a very serious illness to need to be in the hospital or lose their battle to COVID-19. I lost a very dear friend to COVID-19 back in the summer, and it's a very tragic way to go. So right now, though, again, we have the promise of vaccines. And the main thing I would want folks to understand is we keep begging, asking. I'm on calls every day with the federal government, urging them to please do whatever they can to increase the supply of vaccine that we get in Texas. And I know they want to. I know they're making efforts to do that. But really, when you think about it, right now we have 2 vaccines that are available in the United States under what's called emergency use authorization, which is a special kind of authorization that the Food and Drug Administration undertakes. And those are made by 2 manufacturers. And, you know, it's not like, what I want to say, it's not like punching out aluminum cans. I mean, you can't just turn up the speed at which you produce this. This is still a very sophisticated process that requires a lot of quality control. And so there's a limit to how much they can produce, although they are telling us that we will be getting more, but it's not spectacularly more. It's not triple or 5 times the amount. It's going to be, you know, maybe 15, 16% increases over the next several weeks.
Well, Dr. Hellerstedt, let me stop you right there. In terms, what are we currently getting in the state of Texas as it relates to these vaccines?
This week, we shipped, or the allotment that's shipping out this week is about 330,000 doses.
And that's for the entire state of Texas?
Yes.
330,000. Now, I know Dallas County, the city of Dallas ended up, I believe, getting about 5,000 doses. Did that come out of the allotment that was provided to the state?
Yes, and let me make clear how the vaccine gets to folks. Basically, the federal government tells the Department of State Health Services, my agency, how many vaccines are going to be shipped to providers in Texas. And there's, again, the 2 different types of vaccines. So they tell us how much of the Pfizer we're going to get and how much of the Moderna that we're allotted. We, the Texas Department of State Health Services, do not physically receive the vaccine. We simply make a designation of who among our registered providers is going to get the vaccine. And so then that vaccine is shipped directly to the people that we designate. And that's actually, that piece of it has gone very well. So typically we'll find out, like I believe we found out today what our allotment will be for next week. And I don't want to quote a figure because I might quote you incorrectly, but it is slightly more than what we had. And then once we make those designations of who's going to get it, it typically ships Monday, Tuesday, Wednesday of the next week. And that's what we expect.
And let me make certain that everyone understands, you know, and we'll talk about redistricting on another town hall meeting. There's an estimate 29 million Texans, 29 million. And frankly, we're supposed to vaccinate all of those 29 million. Is that correct, Dr. Hellerstedt?
Well, it's actually right now the lowest age range for any of the vaccines is the Pfizer, that's age 16.
16.
Moderna is age 18. So it's actually somewhat less than the entire population. But yes, it's still, you know, many, many millions, which is many times what we're getting right now.
And the point of, because I know a lot of your questions, and we're going to open it up for questions here in a minute, is concerning the distribution and the allocation. Now, mind you, there are millions of people in the state of Texas that we need to make certain that is provided this vaccine. And so there is a advisory committee to Dr. Hellerstedt that helps him with the prioritization of vaccines. And I know those are questions that you want to ask tonight. And so we're gonna get into that in a few minutes. And would you briefly talk about the committee and what their function, the advisory committee is and what their function?
Absolutely, Senator. So we call it the Expert Vaccine Allocation Panel, and it's a group of 17 individuals that are appointed to advise me in terms of the priorities for vaccine allocation. It includes 4 legislators, 2 from the Senate, 2 from the House, and as well as folks with backgrounds in vaccine development, physicians, infectious disease specialists, folks who run public health departments in cities around the state, and then Chief Nimkid, who is with the Texas Division of Emergency Management, who are essentially experts in logistics and moving things around. And that was especially useful early on when we were in fact receiving and moving around a lot of personal protective equipment that was in short supply. So they set up their independent, if you will. When I spoke to them, and I don't meet with them personally, I let them conduct their own business and make their own decisions. But the one thing that I told them is, you're knights of the round table, okay? Nobody outranks anybody else. In particular, the electeds are there to provide their perspective on it, whereas the other experts there are there to provide their perspective on it. And I think we have an excellent group here in Texas, an excellent system that then makes the prioritization. So the two things that the priority populations that they've identified now are kind of what we call phase 1A and phase 1B. So if you will, I'd like to kind of explain the reasoning behind how they pick those, how they identified those populations. So
Okay.
phase 1A would be healthcare workers, particularly those who are directly involved with caring for COVID patients. The other group in phase 1A are folks in long-term care. So folks in nursing homes and assisted living, as well as the staff in those types of settings. So back to the hospitals. Well, one of the things about that, if you're in a hospital that's taking care of COVID-19 patients, it's unique in that your environment is, you know that you're exposed to COVID every single day, every minute that you're at work. And so that puts you in the highest risk that there can be in terms of exposure, especially if people are working in somewhere like an ICU where people are on ventilators and things like that. Yes, they have personal protective equipment. Yes, they're trained in infection control. And I think it's a blessing that we've gone as far as we have without more healthcare workers falling sick because of COVID. But one of the things that I did before becoming commissioner is I was a physician executive in the hospital system here in Austin. And one of the things that it taught me is that a hospital, a well-functioning hospital is a team, it's an organism. And so the folks we wanted to vaccinate were not just doctors and nurses. We wanted to vaccinate the people who work in food service. We wanted to vaccinate people who work in housekeeping, because you have to keep all of those functions in the hospital moving, or you can't take care of people the way you need to, especially when you're busy, super busy, and very, very high census of folks. So that's the rationale for the healthcare piece of 1A. The rationale for the folks in long-term care is that if you look at the number of cases, especially the deaths, especially early on in COVID-19 in Texas, that was where the people were getting hit the hardest, was in those long-term care facilities. The vaccine, the infection rather, was coming in from the outside. It was coming in from the community in the form of the folks who work on their staff. And then it would go through the residents of those facilities. And so we very much wanted to stop that cycle by vaccinating both the staff and the folks who are there. By doing that, we would naturally be selecting for people who are most at risk, not just for losing their life, but also most at risk for going into the hospital. And as I stated earlier, preserving that hospital capacity was the most precious thing that we had. So we have, they've done a phenomenal job. They're not quite done yet with doing the nursing facilities and long-term care, but they've done a phenomenal job, and they've given tens of thousands of vaccines to the residents and staff. I think that's one of the things that is going to produce we'll be able to measure it rather shortly, I think, rather soon. We're going to start to see sustainable decreases in the number of individuals who are in hospitals on any given day in Texas. And that will be a blessed day indeed, because we will have a whole lot more breathing room, if you will, in terms of how we have to approach this. And it's going to accelerate our return to more normal life.
All right, thank you. Now, let me also acknowledge some others that have joined. I see Clyde Harrison, the mayor of the great city of Lancaster. I see Judge Clay Jenkins. Thank you very much for being here. I saw Trustee Maxie Johnson come on. And I'm pretty certain there are others that have come on. And let me tell you the problem we're having tonight. The maximum capacity that the state will allow any legislator that uses state Zoom facility to have, the maximum capacity is 100 people. And we have people blowing up our lines because they can't get in. And so hopefully we'll be able to get this message out. I want to get into asking some specific questions because I'm looking at the expressions on your faces, and I know that you have questions that you want to ask, okay? And so what I'm going to ask LaWanda Barton to begin asking some of the questions. But let me go to this question first because one of the questions, Dr. Hellerstedt, that we've been getting, there was a Dallas County, and I see Dr. Clay Jenkins on here also. Dallas County adopted a plan that prioritized certain zip codes. And it appeared as though, and I haven't looked into the specifics, that Tarrant County did the same thing. Now, there may very well have been some difference, but the appearance looks like Dallas County and Tarrant County adopted prioritization plans based on zip codes. Dallas County was warned by you that if they didn't open it up to everyone, that Dallas County would be in a position where they could lose the vaccines coming in. Can you kind of take us through that? And Clay, and I don't want to spend a long time on this because we're going to ask questions, but I want to get some clarification in terms of what happened there.
Absolutely. So here's my understanding of it. And the difference is that between reaching out and making a special effort to enlist people in certain communities and get them vaccinated, making them a priority. It's a difference between that and saying you cannot get the vaccine unless you reside in a certain area. And that to me was my understanding, that's the difference. We can't exclude people. We can definitely reach out to people. We can say, we can get phone banks. We can have community organizations, churches, that sort of thing, help to cooperate to reach out and identify people and recruit them and get them on the list, get them an appointment, get them to the appointment and get them vaccinated. But if in doing that, there's still other vaccine available, we don't want it so that you can only get it because you live in a particular place. We want people to be able to access it. And it's because this vaccine is a commonly held good. It doesn't belong to any one of us. It belongs to all of us.
Okay, and Clay, as relates to what Dr. Hellerstedt just said, what type of outreach efforts do we have in Dallas County? One of the big issues again is obviously you have minorities in my senatorial district that are at risk, as well as across the country, but I'm looking at my senatorial district. What outreach efforts does the county have in order to make certain that persons in those particular areas are getting registered and also have the ability to get the vaccine?
That's a great question. And we need, am I unmuted? Can y'all hear me?
Yes.
Okay. And it's a great question and we need everyone's help on this. So tomorrow we'll have a specially called meeting of the Commissioners Court to put in place a Dallas-based, I believe it's a Southern Dallas-based company that will do a call center in both English and Spanish, both on outreach and on sign up. So they'll call you to encourage you to sign up, but you have to call back so that you don't get scammed to call them to sign up. And then as you have seen, we are partnering with city council persons, church people. You could be the mayor of Lancaster or a city council person in Lancaster or a church, Cockrell Hill, anyone who has a couple of laptops and a hotspot, and we'll work with you because anyone can sign up someone to our website. So people can go on the website tonight at dallascounty.org and they can sign themselves up, or they can sign their grandma up, or they can sign their neighbor up. Some people will call the number and do it by phone, but there's a lot of people who, if there's not an event and they can't go somewhere and have someone walking through it, may not do it. And so we need all of our city council people, all of our churches, all of our, anyone who's having, I know some of the sororities right now aren't having in-person events, but anyone who's comfortable having an in-person event, contact my office, partner with us, and let's get outreach going. I've got a call, I think tomorrow, center with 100 people invited who are school board members, city council people. I don't know who all it is because I didn't come up with the invitation list, but they're all people that are believed to perhaps be interested in doing some of these events, primarily in South Dallas, but I know I saw a name on there of a city council person in Terrell, Texas. So people from all over that can do these great events and help get the community. So the person in Terrell, Texas happens to be, I believe, the first Hispanic city council person in Terrell. I believe there's an African-American city council person in a tiny city. I can't think which city it is now, but in one of the surrounding counties. So we're going to need help in getting those hard reach communities and getting them on the list. Once you get on the list, we can prioritize zip codes. As Dr. Hellerstedt said, we cannot exclude people from the possibility of a shot, but we can prioritize based on proximity. Proximity means the neighborhoods with the most COVID, the neighborhoods with the highest risk. And then we can do vulnerability. The person who, if they get COVID, is statistically likely to have a bad outcome. Anyone could have a bad outcome, but a 75-year-old is more likely to have a bad outcome than a 65-year-old. A 65-year-old with diabetes is more likely to have a bad outcome than a 65-year-old who has no underlying conditions. And so we're looking at all that, and we're trying to get better every day. If we get a question, I'll talk to you about our frustrations with equity thus far and what we plan to do to address that.
Okay, very good. And I know Councilwoman Carolyn King Arnold has been working. In fact, I was on a call with her last night concerning this very issue. And I know the city has been working on the issue. She came up with a term, and here's the term, GTVO. And so Councilwoman King, kind of give us an idea of exactly how you're helping to coordinate bringing people together and answering questions or questions that you need to pose to the commissioner that you're getting from our mutual constituents. But tell us what GTVO first means.
GOTV means to get out the vaccine. Get out the vaccine. And so that's what we're trying to do. So we've started with our elected officials, because in my case, about all of the elected officials represent District 4. So we started off with the kickoff last night. And so we will be branching out to our faith-based leaders and some of the other business leaders to help us as we move out. But it's all about education. But we thought we would definitely work on the focus of GOTV to capture their attention, to get that vote out. So I did want to make sure that we did a little plug for that. And thank you, Senator, for joining us last night.
Okay, and there are other elected officials on here. And to the extent that you have a question, make sure we put it in the chat. But what I want to do now is to go to some of our constituents that we have here and answer questions. So Luana, let's start asking questions to Dr. Hellerstedt based on the 50, 60 questions that we have. Is there any coordination between the state, the county, and the cities within Dallas County? I'll ask Dr. Hellerstedt that question and then ask some of the mayors the same question.
Well, absolutely. I mean, a lot of what is going on, we've had some outreach to potential providers in the areas that you and I had talked about in my office, with my office, kind of trying to outreach and recruit people to be providers. Likewise, just the whole area, one of our chief strategies now is to have what we call hubs that are able to deliver very high amounts of vaccine on a daily basis. These hubs are so successful that they really use all of the vaccine that they're given within the first few days of receiving it. And so to the degree that there's still areas or providers that haven't yet received any vaccine, it's because of the overall just lack of vaccine that we have. But with every week that goes by and the more doses that we provide to folks, then we're going to get further and further into that group of people. But yes, I mean, we work with the vaccine providers, and they work among themselves at the local city and county level.
Okay, Reverend Smith has a question also. How can churches be a resource as a hub? I'll ask Clay Jenkins. I'll ask Clyde Hellerstedt, the mayor from the city of Lancaster. Let's see, can we get the...
Yeah, getting the truth out and getting the information out to our congregation concerning distribution and getting tested and vaccine and all that. Is getting the truth out to them. That's how we can help. Now, I don't know, maybe Clay, Judge Jenkins can maybe give a little more information on, because I'm thinking churches want to open up and be a vaccine hub or what have you. I can't give advice on that, but I will say that we need to get the information out to our congregation.
The question becomes one of when we begin looking at the churches, Dr. Hellerstedt, Clay, and we have a lot of churches that want to be hubs, that be able to provide opportunities to get the vaccination. How do we make certain they're able to do that?
You've got vaccination hubs. The state right now is favoring large sites like the Convention Center in Arlington, K. Bailey Hutchinson, Fair Park, and others for those. We are looking at how we would take that mobily, how we would have smaller sites. We're just not there yet. And I'd let Dr. Hellerstedt talk about that. The sort of hubs that we need to open right now, though, are registration hubs. And any church can be a registration hub. Any barber shop, any grocery store, any business of any type. All you really need to be a registration hub is internet through a hotspot. And the county, by the way, can help with some of these. We don't have enough for everybody in the world if everybody does it. We have a few. We've provided them for all the ones that have happened so far. We've provided the computers and the hotspot. But most churches will already have 3 or 4 laptop computers and a hotspot. And you just sit down with your people and help them through and submit. And you could submit 10 or 15 people an hour if you're fast on that. And it's good to have a couple of bilingual people there depending on where you are. Anybody can do that. Anybody can partner with us. Dallas County Health and Human Services can get you the information in any city or any church. We would love to have you be an outreach person, folks registered. I think Mayor Harrison had a good point too. Start with your own membership, get the word out. We want to get people registered. We can only get equity long-term on the list if we get sign up people in hard to reach communities onto the list.
Okay, very good. Dr. Hellerstedt, there's a question from Mayor Gordon of Duncanville. If someone has had
if someone high risk,
if someone was in a high risk category and had COVID and recovered, does that person need the vaccine?
The recommendation is yes, they should still get the vaccine. We know from some of the trials that went on as they were proving the safety and effectiveness of the vaccine, that people enrolled in a study, if you will, to be part of that. So part of the study early on in the research to approve the vaccine, they would draw blood from people. They saw that there were a certain percentage of people who had formed immune response, who had formed antibodies to the SARS-CoV-2 virus, which is the cause of the COVID-19 disease. And they saw no more adverse effects. In other words, no more side effects in those people. So those people had COVID. They, in many cases, didn't know it, but they had COVID, they got the vaccine, and it didn't produce any particular problems at all. And one of the things is we just want to use, if you will, belt and suspenders in this case. And so even if somebody's had COVID, we want them to get the protection of the vaccine, because through the science, through the studies that we've done, they get the vaccine, they get their booster on time, and we know that that bolsters them and gives them more sustained immune response. Number one. Number two, one of the interesting things that I have to keep reminding myself, and I would want everybody to realize, is even though our testing has revealed basically over 2 million proven cases of COVID in the state of Texas, there's probably anywhere between 3 and 5 times that many people who actually had the infection and either never got tested or had so few or no symptoms that they never felt like they needed to get tested. So there's lots of people out there that have had the disease, but we still want everyone to get immunized, because we know the science behind it provides a very solid level of protection against getting sick. You know, these vaccines are 94, 95% effective in preventing people from getting sick from COVID-19. In the world of vaccines, that's golden.
That was the very next question too. But Hope Stevens asked this question. Pre-existing conditions include COPD, but not asthma. Why?
Well, the list that we provide is what I would call inclusive, not exclusive. And it really states that. So what we're trying to say is we're listing those things knowing that there's solid science proof through the number of people that succumb to the disease, who lose their life to the disease, or have a very serious course with COVID-19. And we know the research shows that the diseases we list are capable of doing that. I would say, though, that if you have asthma, you've got a chronic health condition, it's a respiratory condition, and you should qualify.
Is that something then that left to the county's discretion or the city's discretion, or what? You can include
yes, I mean, the thing of it is we couldn't produce an exhaustive list of things. And so I would say, you know, if you have a provider, if you have a clinic that you go to and get a note, if that's something that helps you to convince the vaccine provider that you need it. In most of the situations that I've been in, I haven't seen people asking a whole lot of specifics. What they're really asking is, do you have a chronic underlying health condition? And if you say yes to that, then you know you're up there. Again, it's age, 65 and older. But even within that, we would want to prioritize people who have underlying health conditions, and then it's between ages 16 and older with chronic health conditions. But keep in mind that the central fact about vaccines right now is we want more and more and more vaccines. And I was just on a call with the new team in the White House. They understood completely what we were saying, what we were wanting, and they are going to do their very best to get more vaccine out to the entire country, including Texas.
Okay, here's a question. This is from Councilwoman Arnold. We need to identify resources to provide vaccines to seniors with limited mobility and require home services. I know that you just said a few moments ago that the state has provided some 14,000 employees, I guess temporary employees for hospitals. Is that correct?
That's correct.
Okay, and so obviously that revenue comes out of your budget, I assume general revenue, plus probably federal dollars comes down from the CARES Act. Am I correct about those streams?
Most of it's federal money.
Okay, so as it relates to providing counties throughout the state of Texas, additional counties, cities, additional resources in order to have mobile units going to some of these areas where we have seniors that and other persons that have limited mobility. How do we get that done?
I think we get that done through the way that you're suggesting, and that'll be when we get to the point where we have sufficient vaccine that we can mobilize the forces. We can maybe divert some of the resources that we have to spend in hospitals. And as the crisis, if you will, in hospitals relaxes, those folks are all licensed professionals that we have contracted with to hire. So they could potentially be repurposed for that. One of the things, though, back to the question about how can a community of faith or some other civic organization help? That's a great example of it. If they can not only sign people up and be registration hubs, if they can help with that transportation to the vaccine hub, that would be a great service indeed. You have to remember, it's the vaccination, we're using the hubs as we are because they become assembly lines, if you will. And I mean that in a good sense. I hear nothing but compliments, by the way, from people who've gone through the process. They're impressed with how efficient it is. They're impressed with how person-centered it is and what a great experience they have. But boy, oh boy, can they really put vaccine in arms in a very efficient way, so that it's like if you had a barber shop with 20 chairs and none of them is empty for any period of time, you just keep rotating people through. So getting the most number of people to be vaccinated is really the strategy here. And that's why we're using the hubs and being so successful at it. We really had a conversation with the federal government today. I think when we explained to them how efficient we were doing, we could absorb 2, 3, 5 times as much vaccine if we could get it from them. And even though we would probably still want to use the hubs, as we got more and more, and we got to the point where the hubs could vaccinate 7 days a week and not run out, we would have then enough to be giving to local pharmacies, FQHCs, doctors' offices, and getting it further and further out into the community. But we should never forget that, getting vaccinated yourself is a great thing, but your neighbor getting vaccinated is a good thing too. And we have to have all of that in the community to create this community level of immunity. And that is what is going to ultimately stop COVID in its tracks.
Okay, I know that Trustee Foreman with the Dallas Independent School District, I think we need to unmute Joyce Foreman. And Joyce, you need to unmute yourself.
I've asked her to unmute.
Okay, you have a question?
Yes, my question is, when are we talking about ensuring that all of the teachers and staffs within the schools are get the vaccine?
Okay, Dr. Hellerstedt.
Right now, that's something that's under consideration by the expert vaccine allocation panel that I discussed. So they haven't really made a decision yet as to when that would be possible. But keep in mind, one of the reasons that they outlined the population, the priority populations the way we did. So I really kind of talked about 1A. I've mentioned briefly 1B. 1B, again, is anybody 65 years or older, or anybody 16 years or older with a chronic medical condition. And really, right now, if a teacher is in one of those two categories, they can absolutely access the vaccine now. But what we don't have yet would be a category where a healthy 28-year-old with no complicating medical conditions, but is a school teacher or is in some other population of level of employment that that the panel advises or recommends that they be prioritized for the vaccine over other types of employment, over other types of occupations, then that will be something that they are considering going forward.
So let me please remind you, as you're making that consideration, that these teachers and staff are in contact with our children on a daily basis. And we do have young teachers who are getting the virus, and some of this is going throughout the schools, and we're having to close schools. So I would just strongly suggest that maybe some of your panel members would talk to some of us that are involved in public education to be able to address this issue.
Yes, ma'am.
And let me move on here. Thank you very much, Joyce, for your advocacy over these many years for our students and also our teachers. C.W. Whitaker has a question in terms of which vaccine is best. Is there between Pfizer and Moderna, which one is best? That's
The beauty is they're equal. The beauty is they're equal. They, officially the numbers, I think for Moderna is 94.5 and for Pfizer is 95%. That 0.5% is really no difference whatsoever. They're both amazing. They both use a type of technology that is, if you will, a cutting edge kind of technology. We don't have any other routine vaccinations in the United States that use the technology that they're using. And it, again, based on the safety and efficacy, it's really remarkable. I mean, we would have been happy in the world of public health with a vaccine that was even 50% effective, because 50% is better than nothing. But now we have two vaccines that are essentially the same, 94, 95% effective. And that is a blessing indeed. I wouldn't hesitate to recommend, if it's offered to you, either one of those vaccines is safe and effective. I'll mention a little bit too. A lot of people are wondering about, oh, well, how did they develop this quickly? Well, one was the government poured a lot of money into it and enabled them to, the drug companies, to accelerate their research. But they didn't skip any of the pieces of the safety and effectiveness trials that were out there. They just put a bigger investment in it. And in particular, the government said to the vaccine manufacturers, if you have a promising vaccine, we want you to start manufacturing millions of doses of that vaccine now, even before it's approved. And the federal government, will take the risk if it turns out that one of your vaccines is not going to work. And so, for example, one of the vaccines that was in the works was being developed by Merck and Company. They said it wasn't working well enough, and so they stopped their vaccine development. But we have what we have as fast as we have because the federal government said, look, we want to make this something where the drug company is not at risk for losing billions and billions of dollars in development. And we want to have hundreds of millions of doses available as soon as possible. So again, it was great foresight. We all wish it would happen and can't wait for it to get more and more as the weeks and months go on. But we are blessed that we are at the point where we are now.
Okay, well, let me ask this question. Johnson & Johnson is about to come online also. I mean, and there is a date that they're going to be for the FDA, I believe it is. And everyone seems as though they're going to be approved also. What does that mean in terms of additional vaccines for people in America, most specifically in Texas?
Well, it means there'll be more, and that's good. Johnson & Johnson, I think we need to be very cautious about assuming things. So they haven't presented their data, but in the past, when vaccines were at this point of development, where the clinical trials were wrapping up and they were pulling together their data and going to submit it to the FDA, that was a few weeks and months ago. That was where Pfizer and Moderna were, and the early indications before they were actually approved were that they would be approved. That's what we're hearing now about Johnson & Johnson. So there's every expectation that it will happen, but it won't happen unless and until that data is actually presented and reviewed in detail by the Food and Drug Administration, and they vote up or down on whether or not to provide what's called emergency use authorization. We hope that it will be as effective in that 90% range. We hope that it'll be as effective as the other two vaccines. Its biggest advantages are, right now, we believe they're only going for a single dose, so you don't need a booster dose. And it'll also be easier to handle. It just requires ordinary refrigeration. It doesn't require the super cold or even the freezing like the Moderna does.
Yeah, I know that, I think Mildred had a question. Mildred, did you have a question? Looks like she's frozen.
Okay, yes, the question was, here, we're in South Dallas, near Zang and Illinois, and we find that in Frisco, Walgreens or CVS or some of the drugstores have it. And we are wondering why we don't have that same dispense at the same kind of drugstore in South Dallas.
Again, it's quantity. When we have more vaccine, we will be able to distribute it to more sites.
Okay, well, thank you very much for that question, because I know Councilman Mark Cook had the same question. I assume, and correct me if I'm wrong, is the contract with CVS and Walgreens with the state of Texas, or is that a national contract?
Well, there's sort of two different efforts. So if there's an individual Walgreens or if there's an individual drugstore that's receiving vaccine from the Department of State Health Services, and then getting folks in the community who are in the category 1A or category 1B and providing vaccinations to them, that vaccine is being allocated to them by the Department of State Health Services.
Okay,
On the national,
I'm sorry, go ahead.
On the national level, Walgreens and CVS have a direct contract with the federal government to receive vaccine and then administer it to residents of those long-term care facilities. So there's two different ways. But if somebody's seeing folks in the neighborhood where there's a pharmacy that's offering it, that would be vaccine that comes from the Department of State Health Services allocation.
So, here's a question that I think is on people's mind also. And so Walgreens and CVS gets part of the allocation, the weekly allocation from the federal government that's distributed by the state. Is that correct?
Well, yes. I mean, we're the ones that direct where.
All right. So in terms of the question, though, is why, in terms of in the southern sector of Dallas, I know Councilwoman Arnold mentioned this to me. We have CVS's and Walgreens, and the question is, are they getting an allocation so they can provide vaccinations just like the ones in the northern sector of Dallas? That's the question.
I can tell you that if the numbers continue to increase the way we have been, I won't use the word promised, but forecast, that we will get increasing amounts of vaccine, yes, eventually more and more places will be able to receive it.
Well, Dr. Hellerstedt, all due respect, you're not answering my question. Okay. Let me, maybe it's
I can't tell you for sure. I can't tell you because I don't know how much we're getting.
Okay, well, what I'd ask you to do, and let me know tomorrow, if we are giving CVS's and Walgreens in the northern sector of the county, and Clay, you may know about this, then my question is, why aren't we doing the same thing in the southern sector of the county in my senatorial district? That's what I'm asking. Do you understand?
I will bring that question before the vaccine allocation panel.
Okay, because I mean, I think that if what we're talking about is being equitable and fair, that if you get CVS's with a contract with the state, then there should be, even if you have to rotate it, okay? It shouldn't go all to CVS's and Walgreens at one specific.
None of those places have a contract with the state. There's no money changing hands between.
No, I'm not talking about money. I'm talking about the allocation of vaccines.
Right, but it's not a contract. They sign up and they qualify as people that we can provide the vaccine to.
And I'm pretty certain we've had those same brand stores to do the same thing in the southern sector of Dallas. And I think, I know we do, because that was one of the things that we talked about in terms of that big old hole, and having CVS and Walgreens sign up so we could dispense vaccines through those particular hubs, for lack of a better term. Yeah. And so the question becomes one, are we putting more allocations with the ones in the north as opposed to the south? That's what I'm asking.
Or
I think that's the question.
another question on that same vein, Doctor, is the state simply allocating to CVS and CVS is choosing where to put it? And if so, what can be done for CVS to engage in equity and where they are putting vaccine? If you're just giving them allotment of what they asked for, I don't know the answer to this, and I'm not trying to put you on the spot, but if we're all about equity and transparency, how about they provide some equity and transparency about where they're putting it out there? Because what CVS is doing, of course, they're not a mass vaccination hub, so they're not making it available to everyone. They're just making it available to people in their neighborhoods.
May I chime in? May I chime in? My name is Dr. Baz. I'm a pediatrician. I'm a transplant to Dallas from Detroit, Michigan. And I have been spending a lot of time in South Dallas for the last few, I guess, weeks in the Fair Park area, but also in Bonton Farms. And what I have observed is these are healthcare deserts. They're deserts. Like, so I understand that we're having these hubs where we're hoping that people will come get vaccinated, and we're finding out that they're not, because number one, they don't know about them. They don't have Wi-Fi. They don't use the same channels that the individuals in North Dallas are using. So they're unaware. They're horribly uninformed. They're very concerned about like vaccine hesitancy and things that might be put in the vaccine, the myths associated with the vaccine. And then finally, if we are able to get them signed up, they can't come. They don't have transportation. You would be so surprised. Some of the schools down there, it's unbelievable how neglected this area is. And so I say that to say that our regular avenues of, as a physician, Dr. Hellerstedt, reaching out to, having the patient take responsibility for their care and like coming to us is not going to work in these neighborhoods. We need to come to them. And so if having, and for vaccination purposes, everyone being vaccinated, like they matter just as much as the North Dallas person, because if they remain unvaccinated, this thing is going to continue to circulate and kill all of us. So what I would recommend is if you could either get in touch with like a Parkland or someone who has a mobile van to have vaccine and actually bring it down to some of these neighborhoods. Or if CVS and Walgreens is the best we can do, which again, for this group, I don't think is very good, like as good as a mobile van. But I mean, these are the ways that you're going to reach these neighborhoods because they are just deserts. And I also want to share that I've been working with bridge builders.
Dr. Bass, I'm going to, because there's 50 million people who want to thank you, and I want you to stay involved in this particular process. Let me finish up, and I'm going to hold on to exactly what Dr. Bass is just saying. I need to know about CVS and Walgreens, and going back to Clay's question, are they just given an allotment and they make a determination in terms of who ends up getting it, or is just someone walking in the store? That's number one. But what I'd like to know also, as it relates to CVS and Walgreens, are those stores in the southern sector getting allocations also? And I said that you can give me that information, Mark. And as it relates to the issue that Dr. Bass brought up, I know that we talked about making certain that we may very well, depending upon what happens with the hospital population, be able to reprioritize some of those contract workers to be a part of those mobile vans, given that there are federal funds that Dr. Hellerstedt has at his discretion. Okay, thank you on that. And I think Sidney Walker asked this question: Fair Park is a super center. Why isn't the governor getting in the helping prioritize zip codes near the center? I think, Sidney, we've answered that particular question. And I think Cheryl Smith had a question. Cheryl, did you have a question that you wanted to ask?
With all due respect, Senator West, you don't want to hear from me right now because I am very frustrated.
Well, you
Just
know,
makes no sense.
Go ahead.
When you have someone come, and thank you so much for the work that you do, but when you have people come to address our community, you come with the answer. And the answer is no, they don't have them in those stores. And yes, we are a desert, and there are a lot of other issues. And I'm just tired of people feeding us stuff that we have to go back and share with our community. We need answers. And I don't talk about putting on the spot, our people on the spot. Our people are dying. And when you have an area where you say it's a disproportionate number of people are impacted, but you don't have the vaccine coming there, the site set up. You don't want to hear from me right now, Senator.
Well, I think I've heard from you, and that's the very reason I wanted you to express your thoughts on it. We've heard from you on this. And again, I see Molly Belt on there also. Molly, do you have any questions?
Senator West, this is Trustee Maxie Johnson. Can you hear me?
Yes, we can. Max, you go ahead.
What is the solution? Because I agree with Dr. Cheryl Smith. What is the solution? And how can we educate our community if this was, it appears this was intentionally done. This was a big miss, a major oversight. So what are we to do in the southern sector? I'm the trustee of 75216. It's in my district. What do I tell my constituent that we have been asking for solutions and there is none? How do we educate them? What do we do? We have older mothers and fathers in our community. What do we do?
Dr. Hellerstedt, you'd like to answer that question?
Well, it's a very difficult question. And in the context of the fact that we don't have as much vaccine as all of us want, it's a very difficult thing to answer. There's no intentionality about this. I mean, I really, that's not the way it works. Why would I do that? Why would anybody in public health do that? Dr. Bass said, you know, there's a dearth of providers in that area. And we've had to, of necessity, think in broad strokes in terms of what's going to get the most number of people in Texas vaccinated. And part of the reason that we picked the criteria the way we did is that we know that those kind of chronic diseases which should qualify a person to get the vaccine are disproportionately represented in communities of color. So the idea is we wanted to create that access. Think about it. The alternative would be to say, no, we're going to do it by virtue of essential industries. Essential industries, that definition was set up really in order to keep those industries going during the pandemic. It was never, in my opinion, set up to say, this is who should get the vaccine first. Otherwise, you end up in a situation where you have a perfectly healthy 28-year-old working at Whole Foods, getting the vaccine ahead of other people who personally, because of their health status, are at much higher risk. So I'm very proud of the fact that we have defined the populations that we want to prioritize based on the person's risk of getting sick or dying from COVID. Once we get more vaccine, many of these problems will go away because there'll be plenty, but that's still weeks and months away. But there's no intention to leave anyone out. We want to be inclusive.
Let me ask
on the west side, one question.
Max, hold for 1 second. Let me ask this question right fast. So the difference between Dallas County and Tarrant County is that Tarrant County prioritized zip codes where they were doing outreach, as I understood. As Dallas County's order basically said that only particular persons would be able to get the vaccine. Is that correct, Dr. Hellerstedt?
I don't know their plans down to that level. As I said at the beginning, we live in a home rule state, and so much of the planning that takes place and the execution.
No, I understand all that, but I mean, in terms of a type of program that's would be sanctioned by the state, if you're just doing outreach in particular zip codes, that's compliant with the laws of the state of Texas concerning this. Is that correct? So therefore, here's the question. I'm going back to what Maxie just asked you. If 75216 if it's outreach that's done in that particular area for people in the 1A or 1B, then that's compliant with what the state is requesting, and those persons can be registered, put on the list, and served. Is that correct?
Absolutely.
Okay.
If they're in those risk populations.
Right. 1A, 1B. And so, Maxie, to answer your question,
Yes, sir.
we need to do more outreach, and I know Carolyn Arnold and others do. We need to do more outreach in 75216.
Yes, sir.
Okay. We need to do more outreach, Clay, in those other zip codes too, Casey, that we need to get people registered, get them in line, so as the vaccines are coming in, that they will be in line, registered to be able to get vaccinated. Okay, that's what needs to happen. And one other question, and then I'm gonna shut up. Are there any mobile units that are operating around the state of Texas that are providing vaccinations?
I can't speak across the entire state. I believe there are. I do know that the possibility of using mobile vaccinations is being explored.
Okay. You said you believe that they are being used across the state in some places?
I don't know for sure. I can't tell you, but it's a big state, so I wouldn't be surprised if somebody is doing that. But I know that at the state level, we are looking at ways to the option of having mobile vaccination.
How difficult would it be for the state to be able to find whether there are any programs in the state that are using mobile units? How difficult
would it be to start one?
Excuse me, please, please.
I'm sorry.
Please.
I thought it was, I'm sorry.
Please. How difficult would it be to find out there?
Oh, I think we could find that out tomorrow.
Okay, and the follow-up question, how difficult would it be to use federal funds that you're receiving through the CARES Act to set up a mobile program in areas where we know that we need to provide additional outreach?
Like I said, we are looking at the option of mobile vaccination right now.
All right, so how soon will you make a decision on that?
I can't tell you. It's being discussed right now.
Well, I mean, at all due respect, if you can't tell me, who can?
I'll get you that information as fast as I can. Please have your office stay in touch with our government relations. I'm not going to promise you something I can't deliver. I mean, it's that simple. I don't have an answer.
Wait a minute. Oh, slow it down. I'm not asking you to promise me anything that you can't deliver. I'm asking you to provide me a timetable when you can come up with a decision. That's what I'm asking.
I'm having discussions with other parts of the government, and I can't speak for how soon we'd be able to deliver on that.
And that's the answer to my question. It's just being discussed right now. So are you discussing it with the governor's office?
Yes.
Okay, is that a decision the governor needs to make or what?
Not directly, I don't think. I mean, we want to look at all of the options that we have to deliver vaccine across the state, including paying attention to access to that vaccination.
Oh, I understand that. I'm talking about mobile units right now. Okay, we'll talk about it more. So I need to visit with the governor's office to make it a priority, to see whether the governor will make it a priority. Is that what you're telling me?
It's up to you if you want to talk to the governor's office about it.
I know it's up to me. I'm asking you, will the governor's office weigh heavily on the decision about creating a mobile unit program in the state of Texas?
Yes.
All of the Department of State Health Services is an executive agency, so yes.
Okay, all right, that was a question. Mauricio, Dr. Hernandez, do you have any questions?
Oh, so I appreciate it. Just thank you, sir. I just, just how we utilize at the campus level, at the high, I'm at a high school, whatever, but how we can help on our end and try to communicate this information through the community. I mean, we're here with open hands. I mean, we're in person. We're trying to do what we can, but we really want to communicate to our parents and our community members. Any place we can play a role in, please let me know or let us know.
Okay, Councilman Thomas, do you have any questions?
Yes, Senator, thank you very much. One of the questions that I have is regarding the process. We discussed last night about the fact that anyone in the state, even though Dallas is getting 5,000 vaccines, anyone in the state of Texas is eligible to go to those centers. Is that a decision that was made by the state? Is that something that's a federal decision? And what was the rationale for making that decision?
Dr. Hellerstedt?
Well, again, the vaccine doesn't belong to any one of us. It belongs to all of us. So that's the rationale for saying that whoever receives the vaccine cannot use the place of residence as a criteria to exclude them from that vaccine if it's available, if they have it. Again, you got to remember there's far more demand for this vaccine than there is supply. That we are very proud of the fact that we have such an efficient delivery system in Texas that the places that we give it to run through that vaccine very quickly. And by the end of the week, they have given out every dose, and there's very, very little wastage. That's quite a success from our standpoint in public health.
This is a question for Judge Jenkins. Sandra Aldridge, who I went to junior high school with, Clay. I went to junior high school with Sandra.
All right.
She asked a question
Let's go
about
Warriors.
Percy Anderson Steers in South Dallas. Will there be, and I guess the city can answer this also, Carolyn, will there be drive-through vaccination sites in Oak Cliff? And I'll start with Judge Jenkins.
So we're actually testing a drive-through vaccination site tomorrow at Fair Park for the concept. I am visiting, and Dr. Hellerstedt knows this, I've been visiting pretty much each day since the weekend with the head of the vaccination coordinator for President Biden, asking, and I think that we've sent tonight a request through the Texas Department of Emergency Management, a request for a mass vaccination hub here in Dallas County that could vaccinate up to 72,000 people in a week here in Dallas. And that probably is a drive-through. So we're testing that. There's a lot going on there, but we already have a drive-through site at Ellis Davis and Eastfield through Parkland. And the KBH site that the city of Dallas will run will be a 5,000 a week drive-through. The challenge as we move to trying to go mega hub, and of course, as Dr. Hellerstedt has pointed it out numerous times, it's a function of getting the vaccine. We have the capability to do throughput. We could probably run 6,000 people a day through Fair Park if we had enough vaccine in the footprint we have right now. Now to get one of those federal mega hubs, we got to get a bigger footprint. But so yeah, we'll be looking at that. I think what both the Biden administration and the state right now are indicating is they want to look at these massive sites that can do thousands and thousands of people because they're very resource intense, right? You're talking about perhaps National Guardsmen or federal troops and whatnot helping run those just because of the sheer size of them. But we get that going, we get a lot of people vaccinated. And by the way, guys, or people on the call, that's why it is so important that we do community outreach, because we're going to have that capability to get to a point, if we can get enough vaccine, to where we can vaccinate a whole lot of people, but we won't have equity if everybody that's on the list is from Collin County and North Dallas, and very few people are on the list from Waxahachie and DeSoto and South Dallas.
That's why that outreach is so important, Matthew. Okay, and Carolyn, and that's what you were talking about last night. Do you want to respond to that?
Right, and let me add this as well, because this is the overriding issue that we have. Number one is transparency, and I think it goes back to messaging. We need to have a coordinated message, because we're getting last minute information, just like we just found out from you, Judge Jenkins, about Fair Park and the mobile. I've just received, and I sent it to you, Senator West, that we are working on the dispensation of 5,000 doses, and we're going to get the information by 10 a.m. on Wednesday morning. For our Friday, I think on Thursday, we're going to start vaccinating. My point is getting a coordinated message so the community understands where these vaccines are and can be alert, check their telephone, check their email, so they're ready to go. And that's the frustration that we're having. So we will be, yes, so we got you, Senator. We're rolling out, I know my office is rolling out a lot of this marketing within the next week.
Okay, and I think it should be coordinated with County Judge Jenkins at the county level. That's where the coordination should be.
Right.
Then,
I have a question regarding vaccines, Senator.
Okay, and Dr. Hellerstedt will be able to provide support to the county and also to the city.
Gotcha.
Someone had a question about the vaccine.
Hey, this is Zach. I had a follow-up question. We keep talking about CVS, but also Tom Thumb's, Kroger's in the northern sector. I know on Inwood has plenty of vaccine early on. So to Dr. Hellerstedt, why didn't the southern Tom Thumb's and Kroger's get the vaccine supply? And also, one last question. You asked about that there was a limited amount of vaccine wasted statewide. Could you get with Senator West's office to give us an idea of how much was the total in Dallas County and throughout the state of vaccine that has been wasted?
We do have those kinds of numbers, so we can look for that. I don't have it in front of me. And as far as how exactly the vaccine distribution worked out, I can't replay that in detail. I just don't have that information.
Well, I'm not trying to ask you to replay it, but I think it's a concern that when I'm on Inwood Road and Tom Thumb has vaccine, and when I'm on Camp Wisdom or in Southern Dallas, there is no vaccine. So that's not a rehearsal, that's just a fact.
So let me ask this question, Dr. Hellerstedt. And I didn't know about Tom Thumbs and all that. And I know that your office has been very cooperative as relates to providing us and helping us to identify providers in that black hole that we saw in Southern Dallas. I hadn't looked at it recently, but I understand through Luana Barton that we're starting to see more populated. But in instances where Tom Thumb and other chain stores have vaccine, I would assume that, and correct me if I'm wrong, that's coming as a result as a distribution that's being provided by the state. Is that correct? Or do you know?
We would have allocated it to those providers, yes.
Okay, so this is what would like for, and I think Imelda's probably, I'm pretty sure Imelda's on here. I just like to know, CVS's, Tom Thumb's, stores like that, are they getting allocations and are they in the northern sector of the city? Because if they are, then I got a problem. I got a real problem when we have some of those same stores in the southern sector.
Thank you.
Of this county also. And so, I need to understand, sir, what was the thinking, if you will, about allocating in the north and not allocating in the south, if that did in fact occur. And so we'll visit about it tomorrow, And so I'd ask that we set up a meeting on that tomorrow so we can cuss and discuss it. And I'll make sure that we get back on it. Let me say this because it's, Dr. Hellerstedt, you have been very gracious with your evening, and I really do appreciate it. There's one other question that I hadn't had a chance to have answered, and that's from Ferris, Texas. We have a councilman from Ferris, Texas, Brooks Williams. Brooks, you have a question?
I do, and that is we're talking about vaccine distribution and availability, but in our more rural areas, we're obviously out of the metro area. We still have first responders that have not been given a vaccine and don't have access to that vaccine. And so at what point will the more rural areas be given that access? Because we're asking these folks to go out and risk their lives every day, and they don't have access to a vaccine, which in my opinion is pretty unacceptable.
Well, can I say something on that?
Yes, sir, absolutely.
Yeah, I know we're working with Wilmer. They have the same problem. So, if you can contact my office, it won't be me that solves it, but I can get the person that will solve it for you to solve it. It's clay.jenkins@dallascounty.org. Okay.
Will do. Yes, sir.
All right, and here is a idea. We have Super Sundays for everything, specifically voting. It would seem as though that we should kind of look at doing somewhat of a Super Sunday to make sure we get everybody possible to register and get on that list, okay? And so I think that we need to take a look at doing that and see whether we can get it done, okay?
Senator, can I say one other thing?
Sure.
I want to say this because a lot of people on this call know me, and you know that from time to time, I don't always agree with the leadership in our state. But I will say Dr. Hellerstedt has been great to work with. He's been very, I can't think of a time where my call's gone to voicemail with Dr. Hellerstedt. He is very accessible, and he's been very helpful. And I want to join the center in thanking you for being on this call, with us tonight. And it's understandable that there's a lot of frustration. I have a lot of frustration, but I really appreciate you and you being here and always being accessible to us.
Yeah, and again, Doc, we may not always agree, and that's fine. I don't have a problem with that. We've never had to be disagreeable. Yes, I'm going to ask tough questions because when I get back home, my constituents are going to be asking the tough questions to me. And I've got to tell them that what the answer is. I tell them that I can't get an answer, and this is why I can't get it. And so I appreciate everything that you're doing. You have never failed to return my call and give me a position on a particular issue. And I look forward to meeting with you tomorrow to talk about that mobile, to the extent that you can find about the mobile and about Tom Thumbs and the CVSs and whether they're getting allocations from the state in the north portions of Dallas and not in the southern portion of Dallas, and why that is. So I can report back, because I know I'm going to be asked that question. And I forgot to provide an answer. You've never had to deal with Cheryl Smith. I got to deal with her almost every day, okay? So I appreciate it. And so thank you for being here with us this evening. Thank each and every one of you. I see Ms. Coleman. Thank you, Ms. Coleman, for being here. And to the extent that we need to have another one of these to follow up on it, I will, or we'll make certain that we send the information out to you that I get from the commissioner. I'm in Austin, so I'm still at the Capitol working for you, okay? And so let's keep on working together and trying to make certain we get people in our communities vaccinated, okay? Have a great evening. Thank you, Dr. Hellerstedt.
My pleasure. Thank you, Senator.
Thank you, Senator.
Take care.
Thank you all.